FIT is the Fund for Innovation and Transformation. It's a program for small and medium-sized organizations in Canada to test innovative solutions to advance gender equality in the Global South.
We've been given funding to develop and pilot this initiative as a small organization as well. As we developed, we didn't really know what would happen. We didn't know if we would get a lot of applicants. We didn't know if people would understand what the purpose was of this fund. And we certainly had no idea what kinds of ideas people were percolating on. But over time and the caliber of the work that we've been seeing, it's just been amazing. What makes us unique is that we're a testing program, so we fund organizations to test their ideas. People are given some leniency to test and experiment, but within a shorter time frame to see if the idea kind of sticks.
Many of them have been able to access additional money based on the work they did. There's so many good ideas. It'd be great if they get to test and then expand what they've done.
We're trying to understand how to capture results for these organizations. We have a couple of team members that are working on, what does this look like? And they've developed a framework to take a look at the programs and the projects and what are some of the critical criteria that are important to assessing whether gender equality has been addressed and is changing. What we're seeing is that there have been changes and it's a progression.
So Ugo Health is a provider of digital health solutions, and we work with communities across Somalia to implement contextualized digital solutions for mothers and caregivers at home. What we did was we've digitalized the 2 maternal and child health facilities, and since then we've noticed over 90% adherence to schedules of children who have returned to their immunization appointments. The solution created individualized calendars from their very first vaccination appointment all the way to the last mile, and each mother received at least 5 SMS appointments, nudges for each vaccination. Since then, we've also scaled. The impact has grown to now 4 regions across the state, spanning 10 districts.
In 2022, I was funded by FIT to test a solar-powered, low-cost breast pump with mothers living in low-resource contexts. In Somalia, only about 3 in 10 babies are exclusively breastfed for those first 6 months of life, so we wanted to know if we were to provide an additional support like a breast pump, especially one that didn't necessarily rely only on electricity, if this would support mothers in being able to breastfeed for longer. And we did actually find this. Moms found it to be relatively easy to use. It helped them in being able to, go to work and school. Their partners were able to participate in the breastfeeding process as well. So all really great things.
There is a role for local partners and smaller organizations here in Canada to actually be part of the international development and cooperation ecosystem. They have a role to play, and there's that trust already. I think the SMOs have proven that they're extremely competent and have a lot of experience and can do a great job.
In a lot of these communities, you can't really affect any change if you don't have a relationship with the local authorities, the local community. And sometimes that's really hard to do when you're such a large organization. There's more staff turnover, there's more of a kind of in and out happening through the communities. With these smaller organizations, they take their time, they spend a long time in the communities, and those relationships help the community feel more comfortable.
The FIT program is enabling that space to connect in a deeper way, and I think the results are even more positive for the people, for the organization, and the learning process is more enriching for everyone.
I've been involved in capacity building initiatives with both the Spur Change program and the Fund for Innovation and Transformation. And I think it's really important that these programs exist. It's really important to support Canadian small, medium-sized organizations as they have wonderful partnerships formed with the communities that they work with, and supporting them through both capacity sharing initiatives and through access to funding is so vital for their success and to advance gender equality in the Global South to support women, girls, and people of all genders. It's been great to have everybody here together, connecting in person. We're a program that's spread all across Canada and around the world, so it's been really wonderful to see these organizations connecting with each other and sharing in person over these past couple of days.
Something that came through in the program that we were really excited about was sort of the conversation around localization and the importance of ensuring that people's voices in the Global South are heard, but also are equal or above the voices in the Global North. We saw some excellent examples of organizations that have really, really good partnerships in the South, and that the power dynamic isn't there. There's an equal relationship. And I think that was played out really, really strongly in our program. Something that the sector could learn from is the work that's been done in this space. There are excellent examples of projects that did this very, very well, and others could benefit from that.
I think the program should continue. I think it's got a place. Canada has a Feminist International Assistance Policy. I think Canada is a leader in that regard, and I think this program exemplifies that.
I really, really hope this program gets funding to continue, because I think it's so important that we support not just the big guys. I mean, they're always going to be there and they do really good work, but there are so many small and medium organizations that are doing incredible work.
I just want to say thanks to FIT and the Intercouncil Network for giving us this opportunity. Really, really grateful for their support.